Hello dear students, today's lecture about first aid algorithm for road accident. First aid before medical aid is provided to citizens in case of accidents, injuries, poisoning and other conditions and diseases that threaten their life and health, by a person obligated to provide first aid in accordance with federal law or with a special rule and having appropriate training, including employees of the internal affairs bodies of the Russian Federation, employees military personnel and employees of state fire service, rescuers of emergency rescue teams and emergency rescue services. Drivers or vehicles and other persons have the right to provide first aid if they have appropriate training and/or skills. 200,000 people die in Russia annually due to lack of first aid. 30,000 die in road accidents. 18,000 die in fires, and 15 because of drowning. Less than 1% of people know how to provide first aid. First aid is effective when it's carried out correctly and as early as possible. According to the WHO, if first aid is provided out of time or incorrectly, then in the first minutes 20–25% of seriously injured people die, and within an hour another 13%. The main causes of death of victims of road traffic accidents: injuries incompatible with life, ambulance delay, and inaction of eyewitnesses. Procedure for providing assistance to victims: inspect the accident site for safety. Turn on the hazard warning lights if you are in the car and place the warning triangle. Assess the situation and make sure of your own safety, otherwise the number of victims may increase. It's necessary. Turn off the engine. If the car crashed into a pool, then electrical lines may be broken. Pull out the ignition key. Put the car on the handbrake. If you can't get to the key, then disconnect the battery. Examine the victims, determine their number. Important to know: a car with a gasoline engine burns out in 5–7 minutes. There is a possibility of an explosion. Call an ambulance. At the scene of the accident, it's better to immediately call an ambulance and then proceed to the provision of the first life-saving measures. Rules for calling an ambulance: speak loudly and clearly. Number the victims. Age, approximately. What happened? Address. Who calls an ambulance? Estimated amount of assistance. Procedure for providing assistance to victims. When can the victim be provided from the car? If there is no consciousness, but there are things of life. If there is no consciousness and no things of life. In any case, if there is a threat of fire, explosion, or hypothermia. You can't remove the victim from the vehicle or offer to get out of it if he complains of pain and conscience. The exception is cases of direct threat to the life of victims and the risk of fire or displacement, fall of vehicle. Who should be examined first? First of all, it is worth approaching the victims who do not show signs of life, and only then to the one who is conscious, moving, screaming, or crying for help. For moral and ethical reasons, first aid should start with children. Removing the conscious victim from the truck. To remove, you need to open the door and turn the victim to his back. After that, you should stick your hands in his armpits and grab his forearm with one hand. Then, with the other hand, load the victim onto your chest and pull him out of the car, while continuing to hold the victim by the forearms. Remove him from the car. Ask a helper or assistant to grab the victim by the legs and carry the victim to a safe distance. To check consciousness, you need to gently shake the victim by the shoulders and ask, "How do you feel? Do you need help?" If there is no answer, stick your hands in his armpits and grab his forearm with one hand. Then, with the other hand, take the victim by the mandible and fix the head. Load the victim on your chest and pull him out of the car, while continuing to hold the victim by the forearm and mandible. Remove him from the car. Ask a helper to grab the victim by the legs and carry the victim to safe distance. Removing a conscious victim from a car through the front door. To remove a conscious victim from a car, open the door, stick your hands in his armpits and grab his forearm with one hand. Then grab the victim's forearm with the other hand. Pull the victim out of the car. While continuing to hold the victim by the forearm, remove him from the car. Ask a helper to grab the victim by the legs and carry the victim to a safe distance. Removing the unconscious victim from the car through the front door. To remove an unconscious victim from a car, open the door, stick your hands in his armpits and grab his forearm with one hand. Then grab the victim's mandible with your other hand and fix the head. While continuing to hold the victim by the forearm and fixing his head, pull him out and remove him from the car. Ask a helper to grab the victim by the legs and carry the victim to a safe distance. Removing the conscious victim from the car through the back door. In case the front door is blocked, it is necessary to try to remove the victim through the back door. To do this, open the rear door of the car, tilt the back of chair back. Stick your hands in his armpits and grab his forearm with one hand. Then grab the victim's forearm with the other hand. Pull him out and remove him from the car, removing the unconscious victim from the car through the back door. To do this, you need to make sure that the victim has no consciousness. Tilt the back of the chair back. Lay the victim down carefully. Stick your hands in his armpits and grab his forearm with one hand. Then grab the victim's mandible with your other hand. Fix his head and pull the victim out and remove him from the car. Removing the victim. Rescue grip. Basic transport provision. The victim is unconscious with preserved signs of life. Stable lateral position. Victim with suspected abdominal and pelvic trauma. Supine position with soft support under bent knees and spread legs. Frog pose. Victim with severe blood loss or with possible signs of shock. Supine position with support under the raised legs. Victim with chest trauma. Semi-sitting position with an inclination towards the affected half of the chest. Who should provide first aid? And what is the legal responsibility for failure to provide? Article 124 of the Criminal Code of Russian Federation. Failure to provide assistance to a patient without good reason by a person obligated to provide it in accordance with the law or with a special rule, if this entailed by negligence the infliction of medium gravity harm to the patient's health, should be punishable by a fine in an amount of up to 40,000 rubles or in the amount of the wage or salary or any other income of the convicted person for a period of up to 3 months or by compulsory works for a term of up to 360 hours, or corrective labor for a term of up to 1 year or arrest for a term of up to 4 months. The same act, if it entailed the death of a patient by negligence or the infliction of grievous harm to his health, should be punished by forced labor for a term of up to 4 years, with or without deprivation of the right to hold certain positions or engage in certain activities for a term of up to 3 years, or by deprivation of liberty for a term of up to 4 years, with deprivation of the right to hold certain position or engage in certain activities for a term of up to 3 years or without one. Reward for provide first aid. Administrative Code, Article 4, Paragraph 5 and 6. Circumstances mitigating administrative responsibility. Prevention by a person who committed an administrative offense of the harmful consequences of an administrative offense. Voluntary compensation by the person who committed an administrative offense for the damage causes or voluntary elimination of the damage caused. Article 61 of the Criminal Code of the Russian Federation. Circumstances mitigating punishment. Providing medical and other assistance to the victim immediately after the commission of the crime. If in the course of first aid there is an unintentional injury to life, health, Article 39 of the Criminal Code of Russian Federation, urgent need or extreme necessity. It is a not crime to harm the interest protected by criminal law in a state of extreme necessity, that is, to eliminate a danger that directly threatens the person and the rights of this person or other persons, the interest of society or the state protected by law, if this danger could not be eliminated by other means, and this was not allowed to exceed the limits of extreme necessity. According to the Criminal Code of Russian Federation, harm to life, health of a person in the process of providing first aid is interpreted as action in a state of extreme necessity and does not are a crime. A crime for doctors, police officers, firefighters, rescues is only failure to provide first aid. Carry out cardiopulmonary resuscitation. If there is no consciousness, determination of the presence of breath. Measures to restore airway patency. Throwing back the head with lifting the chin. Extension of the lower jaw. Determination of the presence of breath using hearing, sign, and touch. If there is breathing, support for respiratory activity, constant monitoring. Injury. Treat the edge of the wound. Wipe the skin around the wound with sterile material and lubricate with iodine. Apply a sterile bandage. Crush and tension. Provide rest. Apply a cold compress, a soft fixing bandage. Dislocated. Create complete immobility in the joint as with a fracture. Do not run. If bleeding occurs, manifested by pallor of the skin, covers, cold sweat, growing, weakness, loss of consciousness, need to be laid the patient on his back with raised legs and urgently call a doctor. External bleeding is subdivided into venous, blood of a dark color, released in a continuous stream, recommended a tight bandage. Arterial, blood of a bright scarlet color, stands out with a powerful pulsating stream. Bleeding is stopped by finger pressing of the vessels above the wound site and applying a tight bandage. Capillary bleeding occurs with a significant wound defect in the skin. The entire surface of the wound bleeds. To stop bleeding, recommended to use a hemostatic sponge, a tight bandage. With loss of consciousness. Causes: high ambient temperature, lack of air, emotional stress, internal bleeding, acute cardiovascular disease. Actions: check for consciousness, breathing, heartbeat. Loss of consciousness in short term, up to 3 minutes. Heartbeat and breathing are saved. Lay the patient on his back. Raise his legs. Unbutton the shirt collar. Loosen the tie and waist belt. Provide air access. Inhale the ammonia vapor. If you lose consciousness for more than 3 minutes, turn the patient onto his stomach. Clear the upper respiratory tract. Apply cold to the head. Observe breathing, heartbeat. Urgently call a medical professional. For fractures. Fractures are classified as open or closed. Signs of a closed fracture: severe pain, a sharp increase in pain when moving or trying to lean on the injured limb, deformation and swelling at the site of injury. Sign of an open fracture: deformation and swelling of the limb at the site of injury. The mandatory presence of a wound. Bone fragments can protrude from the lumen of the wound. Your action: treat the wound. Apply the splint, securing it by the joint above and below the injury. For burns. According to the degree of damage, burns are divided into 4 degrees. First and second degree, skin rednesses and blistering. Third and fourth degree, the appearance of areas of charred skin with abundant release of bloody fluid. Your actions: for burns of first and second degrees, place the burned surface under a stream of cold water as soon as possible. Apply a clean, dry bandage. Apply cold over the fabric. For grade 3 and 4 burns, cover the burned area with a sterile cloth. Apply cold over the cloth. In case of extensive burns, lay the victim with the wound surface up. Cover the burn with a clean cloth. Over the cloth, cold anesthesia. Give plenty of drink, call an ambulance. Calling ambulance and rescue teams to the scene of an accident. Be courageous, compassionate, and sympathetic to the pain of others. Always remember about clear, consistent action when providing help and our commandment. Do not panic. Do no harm. Prevent complications. Use your surfing. Be sure to save. Thanks for your attention.